First I knock, I ensure privacy, I provide the appropriate amount of light, and I wash my hands. And I'm going to introduce myself to my patient. Hello, my name is Mallory, and I'm going to be your nurse today. Can you please state your name and your date of birth? Okay, well, today I'm going to be doing a physical assessment, a head-to-toe physical assessment. Now, at this time, if you have to go use the bathroom, you can. And while you're there, you can go change into your gown. And while my patient is walking, I'm assessing my patient's gown, and my patient's gait is steady. Now that my patient is back into the bed, I'm going to lift the bed up to working height to prevent any injuries to myself. Okay, now that I got into good working height, I'm going to start off by assessing my patient's general appearance and behavior. I'm going to start by assessing the scalp for anything that's abnormal, like lesions or anything. And everything looks good, and I see my patient is well groomed. He has good hygiene, and my patient showing no sign of distress. And my patient is dressed appropriate for the day. Are you having any pain today? Okay, can you rate your pain level being 0, no pain, and 10 being the worst? My patient rated his pain level being a 0, which is really good. My patient is in a good mood and smiling. And my patient is showing no signs of distress. Do you know who you are? Do you know what today is? Okay, and do you know what year it is? My patient is alert and oriented ×3. After I assess my patient's general appearance and behavior, I'm going to start with the skin. First, I'm going to check my patient's skin to see if it's good, like pink, moist, and normal. My patient's skin is pink, moist, and normal on the upper extremities. Now I'm going to check the lower extremities. And it's also pink, moist, and warm in the lower extremities. Now I will check my patient's turgor. Less than 3 seconds, and it was elastic. My patient's well hydrated. Now I will check my patient's temp with the dorsal side of my hand. Now I'm going to do the lower extremities. My patient temp is warm and it's normal, fine. After I do that, I'm going to start listening to my patient's lung sounds to make sure I don't hear anything that's not supposed to be there, like wheezes, bronchi, crackles. We want to make sure that my patient's lungs sounds is clear. First thing I'm going to do before I listen, I'm going to warm my stethoscope in the palms of my hand. After I do that, I will listen to my patient's lung sounds. Starting off, I'm going to listen 6 times here because the right side has 3 lobes and the left side has 2. I'm going to start here and listen at the top lobe. Then I'm going symmetrically over here to the left. Now I'm going to the mid lobe. Now I'm going to the symmetrically over here to the mid lobe. Now I'm going to the base of the lungs. Now I'm going symmetrically over here and listening here. Now I'm going to listen bilaterally close to the axillary right here. Now I'm going symmetrically over here and listening here. If you can help assist me lift my patient up for me. I'm going to lift my patient up. I'm going to listen 6 times back here, starting here. And I'm going to listen symmetrically over here. Now I'm going to the mid lobe right here. I'm going over here, symmetrically. Now I'm going to the base of my patient's lungs. which is closer to the lumbar region. And going symmetrically over here. After I listen to my patient's lung sounds, while I'm back here, I'm assessing for abrasion, wounds, ecchymosis, erythema, and also for his skin, part of the skin, I will assess my patient's skin for erythema, ecchymosis, abrasion, wounds. Now, after I do that, I'm going to listen to the heart sounds. Starting to the right down to intercostal spaces, which is the aortic. Now going to intercostal spaces down to the left, which is the pulmonic. Now going down 3 intercostal spaces to the left, which is the Erb's point. Now going down to the 4th intercostal space, which is the tricuspid. Now going down closer to the mid-clavicle line, the 5th intercostal space, which is mitral. And while I'm already here, I will listen to my patient's heart sound for a full minute. And back from scan, I will assess my patient's lower and upper and lower extremities for ecchymosis, erythema, bruises, and anything that's not supposed to be there. After I do that, I'm now going to assess my patient's abdominal site and listen to his bowel sounds. What I'm going to do first is inspect my patient's abdominal site for pulsation, any distension, masses, bulging, ecchymosis, erythema, wounds, abrasions, and everything looks good. I'm going to, after I inspect, I'm going to listen to my patient's bowel sounds. Letting the belly button be my guide, I'm going to start here. And I'm listening here. And I listen here. And here. After I listen to my patient's bowel sounds, I will let them palpate. Okay, there was no signs of distension or masses. Now I will assess my patient's peripheral pulse sites, starting with the carotid. Then I'll do the other side. Then I will do the brachial. And I'll check the other side. Making sure that I don't check the pulse sites with my thumb because my thumb has a pulse in it. Then now I will check the radial pulses. And as far as I'm checking my patient's carotid, brachial pulse, and now radial, my patient's pulses is very strong. They're not absent, they're very strong. Now I'll check the lower extremities. I'm going to check the popliteal. Now I'll check the posterior tibula. I'll check over here. Now I'll check the dorsalis pedis. Okay, after I do that, while I'm down here, I'm going to check the capillary refill, which needs to be less than 3 seconds. That was less than 3 seconds. Capillary refill there was less than 3 seconds. I'm going to do the upper extremities. Less than 3 seconds. Less than 3 seconds. Now I will palpate for edema. Okay. There's no edema there. No edema here. Now I'll palpate edema to the lower extremities. No edema here. No edema here. After I do that, I will now check my patient's papillary or neurologic system. Sir, I'm gonna ask you to look straight for me. My patient is following the ability of commands very well. Now that my patient looks straight for me, I will now come from the side. Right pupil, constricted. Now I'm gonna check the left. Patient's left pupil also constricted, which is good. Can you please close your eyes for me? This will be my sharp side. This will be my dull. Sharp. Patient responds sharp, dull. Patient responds dull, sharp. Patient responds sharp, dull. Patient responds dull. I'll do the lower extremities. Sharp. Patient responds sharp, dull. Patient responds dull, sharp. Patient responds sharp, sharp. Patient responds sharp, dull. Patient responds dull, sharp. Patient responds sharp. Now I will do my patient's muscular system. I already assessed my patient's gait. He has a good, very steady gait. He's walking really good. Now I'm going to perform range of motion. Are you having any pain as I'm performing range of motion? Patient verbalized he's not experiencing any pain as I'm performing range of motion. Now I'm going to do the lower extremities. Now I'm performing here. Are you having any pain as I'm doing the lower extremities? Patient verbalizes not having any pain as I'm doing the lower extremities. Now I'm gonna test my patient's strength in all his extremities. Sir, can you push up for me? Good. Can you pull my hand for me? Well, pull my hands for me. Good. Can you push? Good. Now I'm gonna do the lower extremities. Can you pull? Can you push? Patient was strong in all extremities. And my patient was able to follow the ability of commands. And my patient's oriented times 3. After I do the neurologic system, I will lower the bed, put the side rail up, putting my patient to a comfortable position. Side rails times 2. And I will put the call bell in reach. And then I will wash my hands before I leave the room, and I will go document the head to toe physical assessment.